Good morning, ladies and gentlemen. This is the Truckers Podcast, FYI. I'm your host, Doug from Ontario, Canada. It is 9:15 a.m. Eastern Standard Time here on the 2nd of September. Today is the official holiday, Labor Day. Hope you enjoyed your weekend. Back into the swing of things tomorrow. Schools here across Ontario go back to school on Wednesday. And just to point out that it is imperative that we are prepared and that everybody is ready to get their kids back into class. Watch out for children walking to school. Stop for school buses in both directions. Slow down in the school zones so everybody can have a safe transition back to school. Now, I talked about this the other day as well, and with the closing of these safe consumption sites. The supervised consumption sites, they have their share of criticism, concerns, and despite their benefits, here are some of the common criticisms. Perpetuation of drug use. Critics argue that the safe consumption sites may enable and perpetuate drug use, providing a safe space for consumption, potentially discouraging a user from seeking treatment. The idea here is, it's just people think that, okay, we're doing nothing. We're just, allowing people to go into these facilities, shoot up, they're supervised, they recover, they go home, whatever the case may be, but they provide other services. The community impact. There are concerns about the impact on the surrounding community, including increasing drug-related activities and crime in the vicinity of these sites, which still has yet to be proven. Legal and ethical issues. In some regions, they operate in legal gray areas or are outright illegal under federal law, which is not true, leading to legal challenges and ethical debates about their operations, which is not true. The government supported these safe consumption sites 5 years ago here in Ontario. Resource allocation. Some argue that resources spent on these safe consumption sites could be better utilized in prevention, treatment, and rehabilitation programs, which these safe consumption sites actually do. They have the resources. They talk to the individuals about the resources. They talk to them about treatment. They talk to them about rehabilitation programs that are available to them. And that's entirely up to the individual. It's up to the individual. It's up to the drug user whether they want to go into treatment, whether they want to go into rehab, whether they want to go into all these programs that are available to them. Closing these safe consumption sites is not going to change that. Resource allocations. Some argue that resources spent on them, like I said, could be better utilized. Stigma and mistrust. There is a significant stigma associated with drug use, and some community members may mistrust or oppose the establishments of these safe consumption sites in their neighborhoods. So these criticisms, they highlight the complexities and challenges of implementing supervised consumption sites, and it is essential to consider both the benefits and the concerns when evaluating their effectiveness and impact. Where are they located? Around social services. To the provincial government and the healthcare providers allocated these sites and where they're going to be located, and the government had to okay them. The city would have to okay them, and which they did. I don't want to close this because it might close. Yeah, it did. So the closures of these supervised consumption sites can have several negative impacts on people who use drugs. I was just reading an article um, this morning too, still, in the news. Um, Doug Ford and the health minister, which is just what she is a health minister. She's not a professional nurse or doctor. Doug Ford is just the premier of Ontario. I don't think they turned around and examined the impact it would have um, on communities, on individuals who use drugs. We didn't have a town hall meeting. We didn't have a meeting with the public. We didn't have public input on their decision to close the safe consumption sites. And with the closure of these safe consumption sites, increased overdose risk. Without access to safe environment, the risk of fatal overdoses increases significantly. And reduced access to health services, that the safe consumption sites often provide access to health services, including addiction treatment and medical care. Closing these sites can limit users' access to these essential services. Their idea of closing this and opening up these rehabilitation, other addiction treatments, and medical care, they think that people who are drug users are going to voluntarily go there. It will also increase public drug use. Without a safe place to use drugs, individuals will resort to using drugs in public spaces, which can increase the risk of harm and public nuisance. They say that these safe consumption sites are causing harm to communities and schools daycares, and children, which they have no facts to back this up. The safety concerns, the closures of these safe consumption sites can create safety concerns for drug users, as they may be more vulnerable to violence and other risks when using drugs in less secure environments. And overall, the closures of these safe consumption sites can lead to increased harm and reduced safety for people who use drugs. So, how can we support these safe consumption sites in our communities? There's several proactive steps. Education and awareness. Educate the community about the benefits of the safe consumption sites, such as reducing overdose deaths, decreasing public drug use, and connecting people with health services, which these safe consumption sites do. We need to have community engagement, involve local residents, businesses, and stakeholders in the planning and decision-making process to ensure their concerns are addressed and their voices are heard, which we haven't done. Advocate for policies and funding that support the establishments and the maintenance of the safe consumption sites, that can include writing a local representative, participating in public forums, and supporting organizations that promote harm reduction. We have collaboration with law enforcement. Work with the law enforcement to ensure that safe consumption sites operate smoothly and do not contribute to increased crime in the area. And monitoring and the evaluation, implement robust monitoring and evaluation system to track the impacts of the safe consumption sites and address any emergency issues promptly. They do this all the time. They're always monitoring these places. Supportive services, which these safe consumption sites already offer, is to ensure that the safe consumption sites are integrated with other support services, such as addiction treatment, mental health services, social services, to provide a comprehensive care for people who use drugs. The safe consumption sites do this already. Now, I don't know where the Ford government is getting their information from that this is causing harm in neighborhoods. That residents, schools, businesses are being harmed, or even children are being harmed because of these safe consumption sites. There's no evidence to support that. Communities, we need to be involved in proactive steps. Education awareness. Educate the community about the benefits of the safe consumption sites, such as reducing overdose deaths, decreasing public drug use, and connecting people to health services. Stakeholders in the planning and decision-making process to ensure their concerns are addressed and their voices are heard. Advocate for policies and funding that support the establishments and the maintenance. They can include writing to local representatives, participating in public forums, and supporting organizations that promote harm reduction, which are these safe consumption sites. The other thing is that how has it helped people? Without these safe consumption sites, we were having approximately 6 overdoses per day that resulted in death. Doug Ford, he says, he's saying to the community, he's saying to the people of Ontario, he's saying to the safe consumption sites that they should be lucky that they're spending $378 million on drug treatment. Well, that $378 million is only going to work if all the drug users are on board to go in for treatment. Because we most certainly can't force them into treatment. Of course, there are people who do want treatment. It's hard to say, the percentage of people who will go to treatment and the percentage of people who won't. In that old saying of not in my backyard syndrome. Not having these safe consumption sites is what they're not going to be able to do, because they're not going to be able to go there. There's not going to be any needle exchange programs. I don't know what makes the government think that people, so these safe consumption sites, first and foremost, are going to be transitions into treatment facilities, such as rehab and other addiction services. I don't know what makes the government think that people are just going to go there. To go back to what they did before, and they're going to find places to shoot up in alleyways, in parks, in their own homes. No one there to supervise them. No one there to save their lives if they overdose. Community awareness, community involvement is important, and it is a discussion to be having. to help. I can't see the government's reasoning behind this. I really can't. It's like the methadone clinics. I think this was just a rational decision made by the made by the Ontario government, not thinking things through. Ladies and gentlemen, so the other, like I said, have open communication, which the government is not having open communications. They're just doing this. We need to have community involvement, education awareness, location considerations. Are they going to be using these safe consumption sites for rehab and rehabilitation in the neighborhoods that they're in? Are they going to move them? Where are they going to go? Hospitals can't take them. Does it mean closing and like I said, does it mean closing them and reopening them as a rehabilitation center? I mean, the government and the municipalities are having a hard time with homelessness, which is a crisis. The municipalities and provincial governments and federal governments, it's a challenge to provide housing, affordable housing. Have already having difficulties addressing all these other issues. I don't know what to tell you. So Doug Ford, um, see the government, the government approved these places where these safe consumption sites are up and running. So the province recently announced supervised consumption sites, designated sites where people can use illicit drugs under the safety and support of trained professionals, can no longer be within 2 meters of daycares or schools. So they're going to be forced to stop providing safe consumption services by March 2025. They will be given the option to transition into treatment hubs. What we can't do, what we shouldn't be doing, is that we cannot remove these lifelines. So the health minister, she says that supervised consumption sites near schools and daycares have prompted complaints from neighbors concerned about discarded needles and drug-related activity, which is not the case. There is absolutely no proven that this has taken place. Good morning, how are you? I'm your host, Doug from Ontario, Canada. This is the Truckers Podcast, FYI. Still in the light of the news that was recently released by the provincial government here in Ontario, Canada, closing these safe consumption sites. After the government has turned around and approved them, they've been here in Ontario for the past 5 years. And that they no longer can be near schools or daycares or any other neighborhoods because they're concerned about the discarded needles and drug-related activity. Well, have you ever been around any of these safe consumption sites, which I have? I have been around them, and there is no discarded needles around them, and there is no drug-related activities outside of them. So I don't know where she gets her information from, this health minister of Ontario. The premier, he says that he's not reversing his decision on closing these safe consumption sites, saying supervised consumption isn't an effective way to combat drug use. That is not an effective way to combat drug use. It's combating drug overdoses. It's preventing drug overdoses. It's preventing people from dying. Yes, we know that rehab, detox works. We know this. But that's if the person wants to go into rehab. That's the person who wants to go into detox. And then he goes on to say that Ford says that advocates and people who use drugs should be very grateful the government is spending $378 million on 19 new homeless and addiction recovery treatments. That they should be grateful. He, of all people, should know how important these safe consumption sites are. His brother died from drug use. Yes, it's important to have rehab. Yes, it is. Yes, it is to have detox centers. Yes, it is. But I don't know where they're thinking that people who are drug users that how many people are, first of all, how many people are going to choose to go into rehab, into detox? We've had rehab, we've had detox all along for years, long before these safe consumption sites came about. Did people go to these places? Probably did. It's going to help somewhat for rehab and detox, but it's only going to help those who want help. There's going to be no more needle exchange programs. People who use drugs and they don't want the treatment, they are going to be shooting up in alleyways. They're going to be shooting up in parks. Wherever they can shoot up, they're going to be shooting up in their own homes if they have a home. No one to supervise them. And the overdose rates are going to go up. Death rates are going to increase. So the frontline workers, the treatment hub should only be one part of the province's response to drug crisis. Supervised consumption site services are needed to keep people alive while using. The ambulances, the hospitals can't respond quickly enough to overdoses in private homes or on the street. So the government says that closing the sites is about encouraging treatment in the form of rehab centers. They encourage treatment in these safe consumption sites. They already offer you these supports in these safe consumption sites. They're just not a place for people just to go in there and they're shoot up in their arms under supervision. They are offered rehab. They are offered detox. And the workers, the frontline workers, you know, um, harm reduction, and that these safe consumption sites provide this, not just from overdoses, but from other diseases like uh, HIV, hepatitis C, and anything else that drug users would get from using dirty needles. We don't have the resources to be out there on foot, combing back alleyways, along riverbanks, finding people who are using and providing them and offering them the services and doing needle exchanges. We don't have the resources to foot patrol like this. And this is what we're going to have to resort back to. $378 million on support of hubs and a rehabilitation and treatment is not nearly enough money. I can only see this, and other healthcare professionals can only see this as an epic failure of the government. And once the overdose and deaths increase because we don't have these safe consumption sites, what is the government going to do about it then? Are they going to own it? Or they're just going to say, well, the treatments are available. Treatments are available now. We have stopped overdoses and deaths because of the safe consumption sites. This is going to be a problem. Now, not just here in Canada, but also in the United States too. You know, examples of neighborhoods that has successfully mobilized supports for the safe consumption sites. And there are several examples of neighborhoods that have successfully mobilized support for supervised consumption sites. New York City have involved building strong coalitions with local stakeholders, including lawmakers, health departments, and law enforcement. And they emphasized on specific benefits of these safe consumption sites and to prioritize transparency in decision making to foster public trust. Philadelphia, advocates have established advocacies into broader overdose prevention coalitions to shape policy dialogues. California have focused on building rapport with the popularity and the power stakeholders who have amplified the impact, and that is important for these safe consumption sites. We have done so here. And the 5 years that these safe consumption sites has been available here in the province of Ontario have proven that it works. Sure, the government can say, okay, we need other hubs. For treatment. But then as the people who are using these drugs, help them better transition from drug use into rehab. Not just shutting them down and say, no, you can't do this anymore. You must go into treatment. You must go into detox. You must go into some sort of rehab. I don't think this is going to end well for the government, and this is not going to end well for drug users. This is an ongoing uh, situation. Um, and for me, you know, I got to get out there, and I got to reach out to people who are involved in the in these safe consumption sites, and hopefully get them on my podcast so they can give a better insight of how these safe consumption sites actually work. Which I'm going to be doing some more research on it today, and research of where they are, because they're not in my community. Not because we didn't want them here, just they're not in our community. And reach out to them and meet with them. And I also think it's important to have town hall meetings, with the communities where these safe consumption sites are, to bring up their concerns. We haven't done any of this. We're just, the government is dropping the hammer just recently. And from healthcare professionals' perspective, it's a bad idea to close these safe consumption sites. The health minister is not a healthcare professional. The Premier of Ontario is not a healthcare professional. And not just from the community and the professionals that are operating these sites, but also the police as well. They say there's discarded needles and nuisance and everything all around these sites. Well, that hasn't been proven yet. So as this information keeps coming out, I mean, I'll try my best to inform you of any changes in any other news that affecting these safe consumption sites, and how important it is, for harm reduction. This is the long weekend. This is Labor Day, official holiday today, Monday. I hope that you got out there and enjoyed the long weekend. I did. I had an extra long weekend. I had taken Friday, just passed, and the Monday off. Obviously, I'm off. It's a statutory holiday. I've had a 4-day weekend. I was able to get out here and do 4 shows. I'm really happy about that. My next show, and it's actually, through the weekdays, not weekends, through the weekdays. Thursdays is a good time for me to do a podcast in the evening, because I don't have my day is not overscheduled. So I will be out here Thursday evening at 8:30 p.m. Eastern Standard Time, and then of course back on Saturday and Sunday mornings at between 8:30 and 9 a.m. to do a podcast. So anyways, take care. Be safe out there. And remember, ladies and gentlemen, that schools here in Ontario return on Wednesday. Be prepared. Stop in both directions for school buses. Watch out for children walking to school so we can have a safe transition from summer holidays back into school. But thanks again for listening. I'm your host, Doug from Ontario, Canada. This is the Truckers Podcast, FYI.